Today, I would like to address with you the concept of guidance about autism. My name is Anne Lamar, and I'm currently a junior at Connecticut College. Before addressing the concept of guidance, I thought it important to address the question on what is autism. 1 in 68 children are diagnosed on the Autism Spectrum Disorder scale, which range from Asperger's, which is the high functioning autism, to classic autism, which is a severe learning disability. Autism is described in the DSM 5, which is a manual of mental disabilities. Additionally, it is important to mention that the diagnosis of autism is not universal in the ways that Hispanic families or other cultures might incorporate their spirituality in their child diagnosis. In research, it is proven that Hispanic families see autism or their child disabilities in a ways of a message sent from God. On this slide, we see common sign of autism, which can be inappropriate play with some toys, inappropriate laughing or crying, a form of hyperactivity, or a strange attachment to object. Additionally, we can see the bigger picture of many signs of a child on the autism spectrum being a challenge of understanding the social norm linked to body language and personal space. So if you want to go back to this slide to give you a sense of what are the signs of autism, please feel free to press pause at the moment. Like said earlier, the goal of this module, if I can say myself, is to describe to you some general strategies to how to manage your autistic child at home. So there's 4 common general strategies that you could use. First, positive reinforcement. Second, visual learning. Third, sign language. And finally, direct language. So let's get more in depth in each of those strategies. Positive reinforcement is to help a child learn new behaviors and find alternatives to repetitive behaviors. So there's 2 types of praise that could be used to reinforce those. First, verbal, which goes pretty straightforward saying, "Great job, keep it up, you got this." But there's also the concept of physical reward, like shown in the picture on the right. So the goal is the student or the child will pick a goal to work for, which he will put at the bottom box. And every time there's a good behavior or a good answer to a problem, a star will be awarded. And in the ways that once all the stars are gained, the child will be able to get what he's working for. This is what positive reinforcement is. Visual learning, on the other hand, is really important for autistic individuals in the ways that they are active learners and not passive learners. So that means that you need to make sure that the child is engaged in their thought processes in the ways that, like shown in the picture on the left, the child was able to design his schedule or her schedule with pictures, and then once the task or the lesson is completed, it goes in the box in the bottom saying all done. As for when we look at the picture in the middle, we see visual support to make better choices or making choices that make the child happy. So that shows the support, that visual support are really essential to learn better when we think of an autistic individual's need. Finally, it's more efficient to use technology like shown on the picture on the right. This is an iPad, for example, used in the classroom. So the steps of a construction sentence is represented on the iPad in the ways that it says, "I want to eat." It will be all different pictures for all those words in the sentence, but using the technology will help the child verbalize its need, his or her needs, to the instructor or his parents. Sign language. We often think of sign language to enhance the communication between the autistic child and the helper, but also it helps the autistic child to describe his or her need, whatever they're physical or psychological. Additionally, I came to notice over time that it helps the teacher communicate without disturbing the entire class with the student in need. So here are some commonly used sign language signs that were used in my classroom. Bathroom is the first one, which is really important in a classroom setting. Then we have more, which can be used both in the classroom or in other settings, such as during meals. Thank you is a pretty self-explanatory one, as well as please. And please can be confusing with happiness. However, please is done clockwise as a circular motion, while happy is the opposite way around. What's wrong is often used by the instructor, not by the student, since the instructor might be questioning the autistic child in a visual manner what's going on. And finally, all done and cleanup could be used often in any settings that when the task is completed. The last strategies that I want to provide you is the use of direct language. So when you communicate with an autistic child, it is important to remember 5 key sentences. Stay calm, give response time, provide choices, state clear expectation, and be patient. But that is not all. My second advice to you is to create a simple sentence saying, first we're going to do some math, then we're going to do some French. Describing it in a way that it's in a step will reduce the stress or the triggers that are linked to expectation rather than seeing the full picture, which can be overwhelming for an autistic child. The next two slides will provide you with some external sources to help you manage your autistic child at home. So there's two types of trainings that are offered on two different websites, but both will provide you with the essential ABA, which stands for Applied Behavioral Analysis Skills, and the services or bilingual, which is awesome to acknowledge the cultural differences, which is offered both in English and in Spanish. Finally, the big overview of those two websites is that they are free and accessible for you in your home setting. So the first website is called OASIS, which stands for Online and Applied System for Intervention, which is a great opportunity for you to get training, as well as PCIT, that refers to Parent-Child Interaction Therapy, which offers similar training and is able to help you gain some skills to assist your child on the autism spectrum. Finally, there's a critical conversation to have with the teacher in order to have a sharing of information to build upon your child's strength rather than on their weaknesses and create a more positive and enthusiastic environment for your child on the autism spectrum to grow. This last slide is to provide you with the references that I used to build this project for you. So, thank you.